State leaders from the governor on down have made it clear that widespread public health restrictions are not coming back despite that situation because, their view, vast majority of those hospitalized are those who chose not to get vaccinated. They've opted in for this. We've heard the governor outline that rationale. I want to bring you a different perspective tonight from Dr. Jen Greenfield of DU. She's a professor of social work who studies public health. She wanted to remind Coloradans of what was so often said early in the pandemic. We're in this together.
My name is Jennifer Greenfield. I'm an associate professor at the Graduate School of Social Work at the University of Denver. I have a PhD in social work and I study the impacts of caregiving on household economics. Well, I know that a lot of folks felt kind of a rush of relief when the vaccines were authorized. Yay! Almost normal.
Today I got to walk into our press briefing room without a mask. If you're vaccinated, you don't need to wear a mask at all.
I was frustrated from the start as we began to roll back the restrictions because we already were seeing Delta starting to surge in other places in the country.
The vast majority of hospitalizations are among that smaller and smaller group of people that are unvaccinated.
I think that there is maybe a misconception that the people who are catching COVID now are those who willfully chose not to get vaccinated and that therefore this is on them. Unfortunately, that disregards, first of all, those who are immune compromised, secondly, those who aren't eligible, and third, and I think really importantly, the healthcare workers and other people who are impacted when COVID surges. And so when we say that it's a pandemic of the unvaccinated, we're forgetting the fact that all of us are impacted in one way or another. I think that part of what has driven this pandemic is that we've lost this sense of community care. And so if we can get back to a place where we agree that we have common goals of staying healthy, maintaining as much individual freedom as we can, but in the context of keeping our families and our communities safe, then I think we could have a more productive conversation about these different choices that we need to make at the policy level.
The perspective of DU's Dr. Jen Greenfield through the lens of our photojournalist Foster Gaines. Dr. Greenfield thought that the bare minimum that we can do, elected officials and citizens alike, is to believe in the best available science.